and workshop session earlier today. It was a lot of fun. I heard some great stuff, and we've got a lot of good chatter going on out there in the Twitterverse. We are going to wrap up today with a very exciting plenary presentation. I'm going to read the formal stuff here. It is a great pleasure to introduce our next speaker, Dr. Amy Park. Dr. Park is the section head of female pelvic medicine and reconstructive surgery in the Obstetrics and Gynecology and Women's Health Institute at the Cleveland Clinic. Now back over to real Chris Morosky. Check out her bio more so in the Hoover app or her Twitter accounts, because Dr. Park is one of those rare people that I have in my life who I met first on Twitter, and really feel like I have developed a professional relationship just because what she likes to kind of converse about really resonates with mine. And I would say like top 5 goals of FDS this year was meeting Dr. Park in person. And so while it's virtual, it still is very cool. And it is very, very nice to meet you, Dr. Park. We are going to have the opportunity today, everybody, to hear Dr. Park talk about leading with your best self, leveraging the power of the internet and social media. Take it away. Thank you so much.
Well, thank you so much, Dr. Morosky. I am so pleased to be able to come today, and I've learned lots of tips so far. And I'm, of course, disappointed about not being able to come to Florida and visiting everybody, but hopefully next year. So thank you so much. This is my Twitter handle at Dr. Amy Park. Feel free to follow me. Andrew, I am having trouble advancing my slides here. Let's see. PowerPoint. Okay, got it. All right, these are my disclosures. So the objectives of my talk are to review strategies that physicians can use to leverage their online presence as change agents, to promote and promulgate the evidence-based medicine, and to review the nuances of different social media platforms. So I just wanted to start off with some icebreaker / food for thought questions. I want to just ask these provocative questions, and then feel free to drop your answer into the chat. I'm sure Dr. Morosky can help summarize some of the answers here or the responses. So do you look up prospective candidates online, whether that be for medical school, residency, or fellowship, or for a job? Or do you look them up on social media? If so, does that online profile influence your decision-making? And do your patients look you up and comment on your online presence, like your videos or details from your bio? So just keep that in mind as we go through this presentation. So I just wanted to start with the context here in terms of our position with the public as medical professionals. In 2019, the AAMC conducted this public opinion research poll. And I just want to highlight here in the middle, well, first of all, the good news is there's the majority of the US public still favorably views the medical schools and teaching hospitals. And they view the most important characteristics for a doctor for us to treat them as a whole person, and to listen and take time to answer questions. However, they're having increasing trouble in finding physicians. And the majority of US adults say that we do care about their patients' interests all or most of the time, which is the good news. However, if you look at, relatively speaking, across the world, we actually rank 24th here, as you can see, in terms of whether or not we can be trusted, with about 58% of the public. Interestingly, we rank 3rd in terms of satisfaction with treatment last received. But obviously, the question of trust for the public is something that we should keep in mind. And this I just wanted to highlight this opinion piece by Dr. Kular about trust in the medical profession and how a growing distrust could be dangerous to public health and safety. And in 1966, by contrast, greater than 75% of Americans had great confidence in medical leaders, and today only about a third do. So just to summarize, I would say people still trust their doctors, but I would summarize it as trust but verify, to quote Ronald Reagan quotes about the US relations with the Soviet Union. We're in the midst of a techno-social revolution. There's a plethora of information on TV and online. There's a lot of information on the internet. And there's different categories. There's information-based websites like WebMD, Mayo Clinic. There's also patient support groups like History Sisters, and then the different social media platforms like Facebook, Twitter, Instagram, and TikTok. So I wanted to rewind a little bit. Prior to the pandemic, in 2019, there was this viewpoint in JAMA titled Counteracting Health Misinformation, a Role for Medical Journals. And I think this table, some of the highlights of this opinion piece was that there's no editorial oversight or curation for these online sources. Fake news spreads faster than the truth on social media. Negative attitudes about science has risen in lockstep with ultra-nationalist sentiments and emergence of populist leaders and movements. For those disadvantaged, despairing, and understandably distrustful of government, alternative truths align with shared skepticism about scientific medicine and belief in traditional remedies. So this table just illustrates some of the counteracting and mitigating strategies to combat and counteract medical misinformation. And I would say mitigation strategies include the containment of dissemination by physicians and the medical community to identify the purveyors of clear-cut misinformation and to debunk the myths and discredit the purveyors of this medical information. And we need to undertake critical reviews of the provenance of misinformation, unveil their credentials and conflicts of interest. And then on the other side of that coin, we need to promote evidence-based medicine about these common misconceptions using websites, digital media, town halls, conventional print and broadcast media, and then prepare the next generation of health professionals to navigate this world of truthiness and pseudoscience. And even the World Health Organization identified vaccine hesitancy as a top 10 threat to global health in 2019. Well, transition to the pandemic. I tweeted this out because I think, we all pivoted to the changes in healthcare due to COVID-19. And this is from May 6th of 2020. Dave Stukas is somebody, a peds allergist that I follow online, and he gave this grand rounds on the rabbit hole of biases, conspiracies, and echo chambers during the COVID-19 pandemic. And we've seen this unfold to the point where now the Surgeon General of the US, Dr. Vivek Murthy, has unrolled this COVID-19 public education campaign on confronting health misinformation about the urgent threat of health misinformation about COVID-19 vaccines. I mean, when we're talking about this vaccine hesitancy, we were talking about infectious diseases like, whooping cough, pertussis, HPV vaccine. But now it's accelerated to the point where the Federation of State Medical Boards has issued a policy and statement about the dissemination of COVID-19 vaccine misinformation and disinformation by physicians. And we could have our licenses revoked. And this statement alludes to the fact that we as physicians hold a trusted position in US society, and we have an ethical and professional responsibility to practice medicine in the best interest of our patients. And we must share information that's factual, scientifically grounded, and consensus driven. And then spreading this misinformation further erodes public trust in the medical profession and puts all patients at risk. So I wanted to invoke Willie Sutton's law, who was a famous bank robber, and his quote was "Go where the money is." Our medical corollary is "Go where the patients are." It doesn't matter what you and I or we think, it matters what they think. And I quote this because I remember thinking myself that these the vaccine unbelievers, so to speak, were sort of crackpots, or they didn't really know the science, and the truth would win out. But as we've seen over the course of this pandemic, especially, it's actually only grown in its ferocity and spread. So again, talking about the techno-social revolution, we are in the midst of societal shifts, cord cutting. There's no more centralized networks or even cable. I remember when I was growing up, there were the three major broadcast networks and PBS, and then newspapers, and that was it. But now we're looking at the decline of newspapers and print media. And then many companies are just exclusively marketing online via Google Ads and on social media like Facebook and Instagram. Online searches are taking over. Essentially 80% of internet users have performed an online search for a health condition, which has increased from 2/3 in 2001. And 2/3 are searching a specific disease or medical condition, and then half are looking at medical treatments or procedures. And these health-related searches are surpassed only by email or researching a product or service. So one example of a website that people turn to is this Hyster Sisters website. It's a woman-to-woman hysterectomy support group. You can see here there's about 500,000 members. There's 5 million posts, 633,000 threads. So this has incredible patient engagement and information here. So what are the other websites or places that patients go for health information? This is a sort of unscientific Dr. Kugel poll of some common conditions in gynecology. I Googled urinary incontinence, pelvic organ prolapse, fibroids, endometrial cancer. And the page one of the Google search were MayoClinic.org, WebMD, Medline Plus, womenshealth.gov, health.harvard.edu, and the cdc.gov. And I wanted to take a moment to highlight Mayo Clinic because I think as an institution, they've really done an excellent job in dominating social media in healthcare. And this article just really lays out how they did that. In 2010, they founded the Mayo Clinic Center for Social Media, and their mission statement was that they believed individuals have the right and responsibility to advocate for their own health, and that it is our responsibility to help them use social media tools to get the best health information, connect with providers and each other, and inspire healthy choices. And I have to say, as a business decision, this is extremely savvy as well, because as many of you know, Rochester, Minnesota is not easy to get to. You have to fly into Minneapolis, it's an hour away, and via drive, or you have to fly directly in. It's actually quite a small community. So I consider Mayo Clinic the pinnacle of US domestic medical tourism, if you will. So you have to draw a lot of people to this medical center in order to maintain its operations. And their online media, social media strategy is to leverage and enhance their reputation as a source of trusted information through their online presence and social media. And the article quotes that 40% of people said that social media would affect their choice of healthcare provider. I would say that Mayo Clinic understands the power of patient engagement on social media. They understand that interaction is important, but patients also want in-depth, great content. They have governance and support from leadership who embraces innovation, and they actually also use social media presence in their academics promotion process. And I put the reference here. So I don't think it's any coincidence that Mayo Clinic is consistently ranked at the top of the best gynecology hospitals. And this is from 2021. You can see here that Mayo Clinic's up top, then there's MSK, and then Cleveland Clinic. And I took this screenshot from the Cleveland Clinic components of the US News and World Report rankings, but about 31% of the score is due to professional recognition, where there's endorsements by respected national organizations demonstrating high standards. Part of that is the nurse magnet hospital recognition, and then expert opinion. And this is percentage of gynecology specialists who named the hospital as among the best for very challenging patients. And this just is a reminder that many of you, I think all of you probably get this, you have to enroll in Doximity in order to get the email. But the way that they solicit these reputation rankings and scores is by sending out a survey on Doximity, and you submit your nominations for the top 5 hospitals in the survey. So on to social media or social network penetration. In 2019, about 3 billion people were using social media, and that was projected to increase to about 3.5 billion by 2023. There's high percentage of social network penetration worldwide, and US users spend about 2 hours per day on social media. I'm sure that number has increased. As many of you probably heard during the pandemic, Apple actually has that feature for screen time usage, and they suspended it for a while because it just got too depressing how much time we were spending online and on screens. So I'm sure it's even increased since then. In terms of statistics, Facebook is the biggie, 2.5 billion monthly users. It mainly skews Gen X and Boomer. Percentage of people using social media on a daily basis, Facebook is 74%, then YouTube, and then Instagram, which is about 1 billion monthly users. It skews more millennial. And then Twitter is about 330 million monthly users. You can see here's third. 2/3 of the users are 35 to 65 years in age, and it's cross-generational. The median age is 40, and it's about 2/3 male. So how is Facebook used by patients? It's often used as a source of support, information, and information for health conditions. I'm going to give some examples, like endometriosis, Nancy's Nook website and Facebook group, and then the APOPS, Association of Pelvic Organ Prolapse group. It's also used as a mobilization tool, anti-Escher groups, anti-mesh groups. Just as the January 6th rioters used Facebook groups, so are patients on health conditions. And I just wanted to highlight in terms of information, this was an article from the Journal of Urology, and this is from the patient's perspective, women's experience with stress urinary incontinence, insights from social media analytics. And they identified these themes in terms of unsatisfying patient-physician interactions, stress incontinence, prevention and risk factors, burden on quality of life. And they looked at the non-surgical versus surgical interventions, and the non-surgical interventions were actually quite interesting. Kegels, yoni, vaginal eggs, Mona Lisa laser were frequently mentioned, and they didn't really even mention incontinence pessaries. Lots of stuff on pre and post-op logistics, post-op complications, advice to seek multiple opinions prior to non-native tissue repair or mesh. And then they did not actually use highly rated websites. And this is really, you can see here on the left here, there's this online engagement, patient-physician interaction, impact on quality of life, decision-making, all this are interrelated themes. Nancy's Nook is a biggie. It's the heavy in endometriosis, patient support groups. At the time that I took the screenshot, it was 137,000 members. It's a significant source of MIGS referrals. When I was in DC, my partner, Jim Robinson, about 1/3 of his practice was from referrals from Nancy's Nook. My partner here, Kara King, is a MIGS surgeon. She says she also estimates in the range of 1/4 to 1/3 of her practice is Nancy's Nook referrals. She says that some of her patients actually even take selfies from the recovery room or from their patient rooms, and so I think it's it's a very interesting phenomenon. There's actually a preferred provider list, and they are heavily into the excision of endometriosis as a preferred approach. And I would say that the medical management multidisciplinary approach is not as heavily emphasized in this group. This APOPS group has about 14,000 members. I've gotten referrals from this group as a preferred provider in DC. I also had one of my patients ask me about PRP injections into the vagina for her rectocele. So it's definitely a source of information for patients to ask about treatment options. Moving on to this documentary, I just mentioned it because it was released in 2018 on Netflix. It's called The Bleeding Edge. And the main narrative is profits over patients. Unfortunately, gynecologic devices were prominently featured, including the Escher, vaginal dehiscences associated with robotic hysterectomy, and transvaginal mesh complications. Most interesting to me was how the anti-Escher activists mobilized via Facebook groups to lobby their US representatives and the FDA to take action against Bayer. And as we all know, the Escher was subsequently taken off the market. If you do a quick search on Facebook about Escher problem support groups, I mean, you can see there's a variety of Escher problem groups, 42,000, 5,000, 2,000 autoimmune symptoms after Escher reversal. There's Sling, the mesh campaign for the anti-mesh groups. This is just one example. This is from the UK. As many of you know, the mesh slings were banned in the UK and Australia and New Zealand. This is just one example from the Facebook group, 8,000 members, and they have a Twitter presence as well. For physicians, Facebook can be used to build practices, build personal brands, build support, as well as activism. And I was so pleased to hear Dr. Evans refer to social media as an important part of her advocacy tactics. Again, Facebook is the biggie here. You can see and this is the accounts for most of the daily use here, and then LinkedIn as well. I just wanted to highlight the Northwestern Gynecology group. I think they do a great job, both the MIGS and urogynecology groups. They post a lot of stuff on their feeds and Twitter, as well as on Facebook. And I've seen them host many Facebook Live events in the past. Just a side note in terms of practice building, I found this fascinating. This woman, Katrina Ubell, she's my friend Linda Yang's Michigan medical school classmate. She actually quit her job as a pediatrician to do this weight loss for female physicians full time. I mean, she has like almost 10,000 people following her. She has a website. She had podcasts and personal and group coaching. In terms of personal brand building, I wanted to highlight Dr. Sasha Shilkut. She actually is a cardiac anesthesiologist in Nebraska. She founded this group called Style MD, and then it's got 10,000 members. She also founded this Brave Enough conference. She has a podcast and conducts coaching and master classes. She wrote a book called Between Grit and Grace, and actually the Cleveland Clinic Women's Professional Staff Association brought her for a book club. And then she has a website with shopping pics. But she parlayed her platform into this New England Journal of Medicine article on social media and the advancement of women physicians. In terms of support, Physicians Moms Group is a big one. You can see here 77,000 members. There's lots of different subgroups, PMG Disney, PMG weight loss, PMG. There's a Physicians Moms Cleveland group, which I actually find very helpful. I was part of one in DC. So I think that there's a lot of support and asking for referrals that occurs on Facebook. Now onto Instagram. It's photo-based with captions. The hashtag use mirrors Twitter. It's owned by Facebook. It's beloved by millennials, influencers, and shoppers. Their data collection is so good that I often joke, how dare they know me so well, because it results in targeted ads. And I've definitely bought stuff off of Instagram ads. And I'm just floored by how they know I needed a Casper mattress or a Quip toothbrush or Lafleur clothes. But anyway, it's also a mechanism for social patient acquisition. And when I came to the Cleveland Clinic, we did do a social patient acquisition or SPA campaign that resulted in pretty high uptake for stress urinary incontinence. And I should have put that in here. I have a slide of the metrics that we collected on the SPA, but you can reach out to me if you have any questions on that one. But just some famous gynecologists in this space on Instagram. Mama Dr. Jones, actually, she just moved to New Zealand, I saw online, but she does a lot of patient-facing education. Dr. Stacy T, she is a gynecologist who trained at Mayo, and I think a lot of people know her as well. She has 90,000 followers, and she also does patient-facing patient education on gynecologic conditions. We have Cleveland Clinic has a OB-GYN tracking residency. So this is one of the main ways that we market our residency program. And this is also an important part of, I think, what residency programs need to do these days with the advent of virtual interviews. There's this website called Virtual OB-GYN Match. You can see here that initially they only had about 1,700 followers. Now they have 4,500. It's probably even more now. It's a resident run, and it's to connect OB-GYN residency and applicants. And they have this Insta story takeovers where different programs will take over their take over for the day, and you can give it a little snapshot in time of a day in the life as a resident in your program, since in-person interviews are off. And I just wanted to highlight this article on it was in the FUMS journal. It's why urogynecologists need to be on social media. It was basically hashtag Urogyn, what's trending on Instagram. They analyzed over 500,000 posts, and the most common hashtags were on the pelvic floor, interstitial cystitis, pelvic pain, incontinence, and prolapse. And actually the most common authors on Instagram, at least, were patients, followed by APPs and then physicians. And APPs actually authored the most informational posts. And I would say that of the APPs, I would say specifically it's pelvic floor physical therapists. There was an accompanying editorial and call to action. They cited the example of urologists, oncologists, and radiologists who were early adapters. Urologists specifically used a simpler portal to compile the hashtags into ontology based on disease processes. And these unified hashtags organize the online forums and discussion on medical topics. So it facilitates, these unified hashtags facilitate online searches for specific topics, enables the development of more research collaborations, and allows the connection of patients and healthcare professionals to discover more relevant content more easily. So I just want to shamelessly plug the GYN Ontology Project. I am the chair of the SGS Social Media Committee, and we compiled a list of hashtags from expert consensus across GYN surgery disciplines, and it's a living list of hashtags. And it was the we had a number of societies sign on to it, including AGL, OGS, ASRM, ICS, IUGA, SGO, Society of Family Planning, and Society of Reproductive Surgeons. And these are just some examples of the hashtags, but I just liken it to a Dewey Decimal System, but online on Twitter. It's a way that you can just hashtag, especially the endometriosis patients and infertility patients, are very, very active. But you can see here some of the terms. And how does the social media affect impact? And I just wanted to highlight this article looking at the use of a coordinated social media strategy to improve dissemination of research and collect solutions related to workforce gender equity. That's one of the things that I like to follow. And you can see that it increased the altimetric attention score by on average 100 to 200 points on if you once these authors put this did a coordinated strategy. So it does help in terms of the hashtags, in terms of coordinating a strategy to raise awareness on issues. And does tweeting improve citations? And they looked at this this one real results from this prospective randomized trial on the thoracic surgery social media network. And you can see that the citations increased from below 1 to 3, and then for the tweeted articles. So it does help bring awareness to the work and to the issues. And they're talking about maybe it's the new impact factor. The Twitter mentions and academic citations in the urologic literature. I just wanted to highlight that it does increase your citation 2 to 3%. So onto Twitter. I'm just gonna say this: if you think it's superficial and unimportant, think of this. President Trump leveraged Twitter and Facebook through Cambridge Analytica to the US presidency. It's a 280 character limit, and I call it my productive time wasting habit. So I alluded to this previously, but Twitter is a mechanism to highlight your residency and connect with prospective candidates. This urology facing one is the Euro residency. It's the home of urology event calendars and the virtual sub-I database. You can showcase your program. Again, the Ob-Gyn virtual match, the Instagram one I highlighted, but this is also they have a Twitter account. You can use Twitter to create lists, and Lizzie Southworth is a Michigan grad who actually also, I think she was an author on this paper that Helen Kang Morgan co-wrote on use of social media in OB/GYN residencies. And I encourage everyone to read this paper because I thought it was very interesting. But anyway, you can have members and followers, and you can follow relevant developments in what you're interested in. I want to also highlight Dr. Hamoud's work. I follow her on Twitter as well, and she and Dr. Morgan have been super active in this our work in stakeholder perspectives on early result acceptance program for OB/GYN residency, and it was published in JAMA. I think it's a great way to keep your finger on the pulse of the latest developments and things that you're interested in. Dr. Graziano gives good hints and tips and tricks on residency interview season tips. And then, of course, Dr. Morosky, I want to shout out that I also super enjoy following Dr. Morosky. He actually, this is a great story. I had Dr. King Morgan come to DC when I was still there and give grand rounds on wellness, and Dr. Elena Tuninsky-Bitten, I've known for a long time as urogynecologist at Hartford, saw it, and she wanted to also bring Dr. King Morgan over, and so they were able to connect, and I just love the connections here. So I also this is anathema as a urogynecologist in terms of assisted vaginal delivery and pelvic floor, but I do have a soft spot in my heart for forceps, the spoons of life, and I see that Dr. Morosky got some louse. And I think it's an important skill to keep up for our residents and future OB/GYNs as an option. So, you know, it's just nice to see what's out there and what people are doing. I think it's also important to see women of color in the field who are advancing. I think it's great that Dr. Cabelli was named chair at WashU, and there was a hashtag called #HerTimeIsNow in terms of promoting women physicians, advancing them to professor, advancing them to chair position, making sure that there's sponsorship and mentorship opportunities available. And if you follow this hashtag, you can see that the work that is going into it, it is conscious work. I think that also you can promote vaccines as a safe option. My husband and I and my son actually were part of the Pfizer COVID vaccine trials. And then you can assess your reach here. You know, this is about 600 people that I normally wouldn't have interacted with, but I think seeing human beings that are undergoing a COVID vaccine trial makes it seem like it's an option and it's safe. And I think it's important for people to realize that we are participating and engaging in evidence-based science. It's a way to promote your program. We dropped down to 3, but previously when we were at number 2, in terms of best gynecology hospitals, I saw a quote by my colleague, Dr. King, that we were ranked number 2. And then I posted a photo of me with my fellows. We're number 2 here. And I tagged a bunch of my team members, not just from FPRS, but from ONC and from MIGS. As a little funny note, this white outfit is something that the surgeons wear here. It's the first and last time that I ever wore it, but it's kind of like a chef's uniform. Like, it seems unpractical, but you just, that's one of the things that is particular to the Cleveland Clinic. Again, back to the platform, Dr. Jen Gunter is probably one of the most famous gynecologists online. She has many hundreds of thousands of followers. She leveraged her platform into this New York Times column, and I'm just highlighting this one that's close to my heart, is Incontinence Inevitable. And she wrote this best-selling book, The Vagina Bible, and actually she just published another one on menopause. Jocelyn is one of my former FRS fellows from MedStar. She's now at University of Pittsburgh. She has almost 15,000 followers. I didn't put this on this version of the screenshot, but she actually tweeted something about the impact of stress and how that affects your life. And that tweet went viral. She had like 500,000 people like that tweet. And then she was referencing a course that she took in medical school. And just from that tweet, she had all these medical student deans contacting her about where they could access information about this, the impact of stress. And this professor had a YouTube channel, and he said he had a huge increase in the number of views. So social media does have an impact and can bring very necessary attention to relevant issues. Again, just like Dr. Southworth had that list, she created this list on Gynfluencers, and you can see there's about 300 subscribers and members. Dr. Fields is a urogynecologist at OHSU, and he wrote this viral tweet about how his mom died of cervical cancer, and he wishes that everyone would vaccinate against HPV because it would have saved his mother and would have changed his life. Well, he leveraged this into a piece for Self magazine. I'm sure now he has even more followers, but I think these social media tweets can have an impact. I mean, 43,000 likes. One of my prior fellows, Lisa Hickman, who's now at Ohio State, has this interest in postpartum care clinics. She set up the one here at Cleveland Clinic with Katie Props. She is setting one up at Ohio State. She connected with this advocacy group. It's called Mothers with Fourth Degree Tears. And she's connecting with them in terms of the grassroots efforts to engage the postpartum moms with fourth degree tears. She also told me she had met with the woman behind this account, and they were brainstorming on research collaborations and how to bring more awareness to this topic. It's a way to connect. Christine Foley is a MIG surgeon at Brown. When she was a fellow, Nancy Cheshire, the Green Journal editor, reached out and asked, who is Doc Foley, Doc Foley GYN, and they were able to connect on Twitter. So I thought that was actually really cool to unfold in real time, to follow it. And of course, just this morning for our plenary session, Dr. Megan Evans touted the importance of social media and advocacy work. And I know she mentioned it a couple of times. And she also alluded to this Ohio HB 413 bill about this bill that was proposed about reimplanting an ectopic pregnancy. And you can see here, it got a lot of retweets, likes, etc. So I think it's important in terms of bringing awareness to issues and advocacy work. It also brings awareness to mental health issues. This was something that unfolded in Australia, where this, they call them registrars. Dr. Kadota was basically the equivalent of a plastic surgery resident, and she wrote this, she was interviewed about her experience. It was actually a huge scandal in the medical world in Australia about how they were treated, especially the female residents, and then the way that people reacted in terms of discounting their mental health issues. And I think it mobilized, this particular case mobilized a lot of the female surgeons in Australia and New Zealand about how female doctors are not the problem. And then they're talking about, this is from New Zealand doctor. Actually, I gave a talk at the Australian Gynecologic Endoscopy Society, AGES, on social media as well. But I just wanted to highlight Dr. Conan's tweets on hashtag gender equity and diversity within OB-GYN. And then they're also trying to highlight the gender pay gap in medicine. So you realize when you follow these people and follow these issues and the hashtags and the thought leaders in the field, that sometimes the struggle is not individual, it's universal, and there can be support across specialties, across programs, and internationally. And so I think you realize the struggle is shared, and we can uplift each other as well. I like to look at my analytics every once in a while just to see how, what the impact of my tweets are. Just wanted to highlight my friend, Suzanne Peterson. She's an MFM at Swedish. She just got their new OB-GYN residency approved in Seattle, and that is the second tracking OB-GYN residency in the US. And I talked to her about trying to increase their online presence in terms of Instagram and Twitter accounts. And I actually think they've done a really good job. But you can follow like how many more followers you have, how many people are visiting your profile, etc. So onto TikTok. This is just the last platform that I'm going to highlight. So this is more teens and 20 somethings. I think the most famous doctor on TikTok is probably Dr. Glaucomflecken. I love this guy. He's an ophthalmologist. He just is, he is able to straddle the line between sarcasm and truth so well. And he does equal opportunity, poking fun at all specialties. I'm just highlighting one where he's talking about Happy Mother's Day. When somebody says they did a fundus exam for the eyes, and then when somebody says they did a fundus exam, it's the uterus, which of course pertains to us. Karen Tang is a MIG surgeon, and she has really garnered quite a following, almost 100,000 followers. And this is a patient-facing TikTok site or account on educating patients on gynecologic conditions. And then my colleague, Dr. King, did a fundraiser for the CDC at the beginning of the pandemic. And you can see half of Dr. Falcone's face here. And it was actually quite a fun little video, but I wanted to just give her props. I remember she came to DC and gave a grand rounds on this topic, social media and your online presence. And I was skeptical, and I was like, whatever, I'm going to tweet her or tweet or twatter or something. And I was skeptical, but I did the things that she said to do, which is to sign up for for my Twitter account and LinkedIn. And I just want to say this is my talk is her talk version 4.0. But I also wanted to highlight that she has a podcast that's co-sponsored by the Society of Gynecologic Surgeons, and it's on it's Gynecologic Surgeons Unscrubbed, and they have a lot of really great topics and issues that they tackle, females in leadership and gynecologic surgery on COVID, operating in the time of COVID, incorporating APPs into your practice, et cetera. So I think they're highly relevant talks. So down to the tangibles of how can you optimize your online presence. So for my Twitter profile, I would, I'm just going to give these examples. You want to use a professional headshot, use doctor or MD as part of your handle and with your name, so people know exactly what you're about. You put a short bio so people know who you are, link to your website bio, put a disclaimer that the opinions and tweets are your own. Make sure that you know your institution's social media policy and keep your posts positive and professional. So I just want to give an example of Dr. Cockcut's old bio. You can see here, it's, you know, she has a little blurb about herself. She's ID in critical care. She's passionate about leadership and personal development. She's a mom. She's a blogger, speaker. But now she's, you know, she kept that, she has a professional photo or headshot. She put a background shot here. She has, her institution here, hashtags. She has her website here. So just ways to optimize. And then these are just some examples of bio templates. You know, Dr. Park is a physician who works with other female physicians to help them be their best selves or whatever it is. And action verbs all along here. We've garnered, secured, worked, supported, and list your accomplishments. And just a word about social media policies. The Cleveland Clinic actually revised this within the past year and a half since I've been here. And I just want to highlight, we're prohibited from posting any content that's personal health information, including patient images. So that includes de-identified patient images from the operating room, like endo or whatever it may be. And then we cannot discuss political campaigns, issues, or take a position on any legislation or law. So just know what your institutional social media policy is. And because I've just heard so many stories of running afoul of this, in addition to your, you know, all the other stuff that you're dealing with, you don't want to get in trouble for this one. The other thing I'm going to put out there is if you put yourself out there as a public figure, just be ready for some heat. And I'm sorry, it's a little blurry here, but I just posted a link a couple years ago about my friend Jeff Clemens, who spoke to the Associated Press on the safe track records of mesh slings to treat stress urinary incontinence. And I definitely got trolled here once I posted the article. People went personal about how surgeons don't follow up. They really went personal, going after these two members of the AUGS boards. And then they're just saying how accusing people of lying here. So just know that they may go after you, and I'll go over specific strategies on how to deal with the trolls later. Pitfalls in practice. You know, this is something to also keep in mind. Somebody posted a photo of how a morcellated organ specimen or morcellated uterine specimen, and they were soliciting guesses on how heavy the specimen was, and it made the news. It was it wasn't a good look. It created, I think there was some censure involved in the hospital part of the for the surgeon. So just think before you post, because there can be downstream sequelae of this. So what are my thoughts about Twitter? And this is just generally about Twitter and online presence. Create your personal narrative and brand. You need to decide for yourself if you have a narrow versus broad focus. I would say I have a broad focus because my personal interests include promoting science, evidence-based medicine, best practices in leadership, work-life balance, women in medicine, stick to reputable sources. I would say that I have other colleagues, like when somebody in my section, Dr. Cecile Ferrando, is a transgender surgeon. She really posts mostly on transgender issues. And then Dr. King posts mostly on surg ed, med ed, surgical coaching. I think I have more of a broad view of, and I just kind of post on what interests me. Reputation building, embrace the humble brag, talk about your work. It does increase the citations. Nobody knows what you're doing unless you tell them about it. That's a mantra of PR professionals, and I encourage people to bring awareness to the work that you're doing. The Cleveland Clinic is a very big department, and I don't really know what's going on unless comes up in meetings or if people are posting about it. Use the platform as an opportunity to become a thought leader. So you can elevate interesting and innovative people, concepts, or work, and retweet others. Be aware of the echo chamber and block the trolls. And I just wanted to quote this person that I really admire, who talks about academic Twitter. Her name is Sarah Mojarad, and she recommends creating personal rules and focus. So again, follow high value accounts. I mean, Dr. Hamoud, Dr. Morosky, Dr. Helen King Morgan. Lots of examples here. ACOG, APGO, SGS. Retweet their high quality posts, add value, create conversations, congratulate others for their achievements. Use Twitter to network. I mean, I haven't met Helen or Chris yet, but we are going to meet someday. Reach out to more experienced Twitter users in real life. Share your ideas. Use hashtag. This hashtag MedEd is a super popular one. Avoid sarcasm and don't plagiarize tweets. So one of the honors of my life was she actually gave me a shout out, which I was super honored by. She said that I advocate for physician wellness and COVID vaccine safety, and I share research updates and amplify people within the field, and how my online presence is an excellent case study on how to effectively build a professional brand on social media. Because I was talking about my friends, I think many of you in APGOG are at Beth Israel in Boston. My best friend Lucy Chi is there, and her girls were participants in the UMass Worcester site COVID vaccine trial for teens. And so they actually were featured on CNN and NPR and the Boston Globe. And so I retweeted some of these articles, and I think we also had some of our own media celebrity. My 10-year-old son enrolled in the Pfizer COVID vaccine trial. He's 10, and we got on the local ABC station. And again, you can have impact, almost 10,000 impressions, about 700 engagements. And actually his little segment was featured in the ABC World News Tonight, as well as the morning news. So I got a lot of texts and emails and direct messages about it. So in terms of creating your own personal brand and narrative, I would say nature abhors a vacuum. So if you don't write your own story, someone else will write it for you. Own the first page of your Google search content. I recommend performing 4 to 6 week online hygiene checks. You can also create a Google alert. Be your best self. If you have any questions or doubts, I would just delete it and try and think about it before you post is the best, would be the best strategy. And I would say my brother works at Google and his opinion is that if it's not online, it doesn't exist. Remember, the digital first impression is something that you can own. Your online identity, meaning your name, profile, and background matters. Like I said earlier, invest in a professional headshot, know your network and intended audience. I concentrate on a physician facing profile. I know some of these anti-mesh groups and lichen sclerosis UK group follows me, but I would really say that my intended audience is fellow physicians. Be authentic and create intentional content. So just perform a branding audit, see who owns your name. So the real estate you don't control is can you be found? But real estate you do control as a website. You can log in, go to GoDaddy or one of these other websites and create your own domain name like dramypark.com or something. You can create a blog either through your institution or on your own. Twitter, LinkedIn, Facebook, Doximity, and Instagram. So I'm just going to give an example of a website bio. This is the template that the Cleveland Clinic gives you. And essentially, this is your time to not be humble. This is the time where you list every little thing. Like, I don't know what this Castle Connolly Exceptional Women in Medicine is, but I put it down. Best doctors in America and top doctors. I don't know who certifies that, but I put that down because patients love it. You know, I put a little bio about myself. I advise you want some detail, but not too long because people tune out if it's too long. And then this is where all the chairs, all the meetings, the committee meetings, all of the things that you're doing, and you just put it down here. And it's your chance to shine. People like to read about you. I have a lot of patients who come in and say, I watched your video. And I'm like, oh, what video? I don't even think I've watched my own video because I find it cringy, but people watch that and they really like it. LinkedIn, I'm going to be honest, I don't really pay a lot of attention to this LinkedIn, but I put it on there because in terms of the algorithm, it does show up on usually on page 1 of the Google search. So I just put in my, where I went to school and where I trained, and at least people know that you exist online. And then regarding website contact, I really like this this graphic about, it's a play on Maslow's hierarchy of needs. It's Maslow's hierarchy of search engine optimization needs. So, you know, you go from the basic things, crawl accessibility, so that that engines can reach and index your content, to compelling content. This is absolutely essential. And then make sure that it's keyword optimized on social media. That also includes the hashtags. You want to have a great user experience, like the fast load speed, ease of use, compelling user interface, share-worthy content, and then the titles. On LinkedIn, there's a way you can edit your link. So that's linkedin.com/Dr. Amy Park. So I would recommend that as well. And I just want to highlight an example. My friend Matt Reeves owns a private abortion clinic in DC. It's called the DuPont Clinic. You can tell his favorite color is purple. But anyway, he has compelling graphics, clean design, professional headshot, talks about his education and his bona fides here. So I recommend that for anybody who has a website or online presence at all, to make sure that those bases are covered. Other content and strategies, patient-oriented videos, like I alluded to, the Cleveland Clinic has one for us. Facebook live chats, rating websites like the hospital system, WebMD, Google, and HealthGrades. And I just want to talk about the rating website. So we do live in a Yelp world, and I call this equation number of stars times number of reviews. So when I moved from DC to Cleveland, I needed somebody new to cut my hair. So I just Googled on Yelp, best Asian hair salon, And then I live on the east side of town. So I looked at these websites over here, or these salons over here. And then I cross-referenced on Instagram, and I just looked at them to see which hairstylist had the haircuts that I liked. And then I decided to go to this place, and actually 2 other people in FPRMS did the same method. No surprise. And we all knew this woman's name. So the same goes for physicians. This was my website from my time in DC when I was at MedStar Health. And I can't tell you how many patients said to me, I looked you up online and I know you're legit, because, and I think they were actually alluding to the number of stars, because I had more patient ratings. Like all of my partners had between 4 and 5 stars in terms of their ratings, but I had the most. I had 830 patient ratings, and people were like, I know you're legit. And I was like, okay, great. I don't know why I had more. Maybe it was just because my clinic site actually was more successful in sending out their the patient surveys. But anyway, if you look at the other websites, ZocDoc, health.usnews.com, vitals.com, they and then the Google reviews, you want between 4 and 5 stars. And I just wanted to highlight that actually you can see here this Google box here. It's actually kind of like a Rotten Tomatoes for patient reviews, and it garners all of these star reviews from the website. And I just want to hone in on this one review that they highlighted here. I had a horrible experience with this doctor. So she says, she was condescending, rude, disrespectful, and pompous. Her bedside manner is horrendous. Moreover, I have more pain now than prior to being under Dr. Park's care. I wouldn't recommend Dr. Park to my worst enemy. I am seeing another doctor to correct Dr. Park's mistake. She was way out of her league for my particular surgery and was arrogant to say so. So after she posted this online, I actually was wondering, why are my clinics kind of slow, and I have a lot of no-shows, and I'm not filling the way I was. And I saw a direct correlation between the posting of this bad review and my clinic fill rate. And after I realized that I had this review, I went through the Kubler-Ross's stages of grieving, and then I was like, I'm going to fight back. So I looked online and I looked at the strategy, and basically what you need to do is bury the review. So solicit grateful patients to submit reviews for you through your institution's patient review system, online patient rating sites, Yelp, and the Google location. That patient actually created that Google location for me so she could insert that. And so the first thing that showed up was half a star review. She did that out of spite. So in any case, I explained the situation to my patients. I talked to my post-op patients who were really grateful. And I said, look, I had a disgruntled patient who put this terrible review on me online. Would you mind putting this in? And they were happy to. So I recommend that you ask patients to do that for you. So in terms of reputation management, the internet may be useful for you, but is not working for you. Prospective employers and patients will be doing searches on you. Significant online damage can be inflicted due to personal and professional grudges. So you can't erase this stuff. It lives on the internet forever. But the good news is, if it's off page 1 of Google, it basically doesn't exist. So my mantra is to create your own story and dominate your profile. Consider setting up a Google alert on yourself so you can monitor negative reviews, hate sites, negative media, maximize Facebook privacy settings. Don't post a lot of photos about your family on social media. Although I will say I am on Facebook and Instagram, but I keep those more personal. So I do post that, but I try and be careful about who I accept as my friends, etc. So key takeaways: flood the zone with evidence-based information, create your own crafted personal narrative, tout your accomplishments, be positive, elevate, do not denigrate, do online hygiene checks, follow your Google page search, and just use this, have fun, and use this as an opportunity to network and to learn from others. I know I went a little over, but I welcome any questions that you may have.
Hey, Dr. Park, I don't know if you can see me here because my Zoom's acting a little funky. If somebody gives me some, there we go. Yeah, I'm back. Hey, that was awesome. I have heard a lot of social media talks over the past few years because it's a hot topic. This was so comprehensive. This was so, I think you really emphasized the importance of paying attention to this. I think we're past the, we don't need to pay attention to this time. This is just what our patients are doing. And we need to engage, especially if we want to give good care and know what's going on out there. We have so many questions. And everybody, I'm doing the wrap up part here too. So it's like, we're going to just do wrap up and all these questions. I do want to get to a bunch of these questions from the audience. One that got a lot of likes and people requested be asked is there some type of help or assistant or a guru or somebody you can counsel with to set up to get your social media started?
I actually, like I said, I was so skeptical about all of this beforehand, and I just read this, or I listened to Kara's talk and I just did it. And then I kind of looked online. I actually think there's books and websites on this. I just kind of like figured it out by looking at what other people, I kind of poked around to see what was a good website. I'm sure, or, good profiles. And I have been to a couple different talks on this, like you said. I think that looking at examples of people who are, I guess, prominent in social media is the way to go. I would say my LinkedIn profile is not like a good example, but I think a lot of people utilize LinkedIn. So I don't know what the comprehensive resource is for that, but I just kind of looked around, and it just really depends on the platform, in terms of Twitter. It's pretty short. You really can't put that much. So you don't really have a choice on, what's on there. And I think Ob-Gyn is actually a pretty small community. So I think it's really, the bio is important, very important. But I think putting the pin tweet on something that is important to you and says something about you, also important. And then the most important thing is generating content and interacting with people.
So that actually ties into another question asked a few times. If you were to get started on this and say you wanted to dedicate yourself to one social media platform, what would be your recommendation for getting started?
I would say, okay, somebody said there's Association of Social Media, but or healthcare social media. I'm sorry, you said platform. I actually, well, okay, I'm Gen X, and I also am more physician facing. So I would say I like Twitter the most. And I think Twitter is more physician facing. It just depends on your goals. I find it more geared towards the issues that I'm interested in. If you're patient facing, I think Instagram and TikTok are probably the way to go. And it depends on what demographic you're looking for. I think that, like, for me, my goals are interaction and following the literature, etc., and the issues. I think that I noticed that people who have very large followings, they're a little spicy. My goal, I'm not interested in being super spicy, so I shy away from that. That's not my thing. I just want to generate the content and interact with people. I follow a lot of the people at APGO, Dr. Claire as well. She has a lot of followers. But anyway, I think it just depends on what you're looking for. You're welcome. But I think it's also, like I said, if you realize that that's you kind of want to think about it. I mean, I don't think you have to be super mindful about all of the things. Like, I think you should just check it out and see which platform appeals to you first before you want to dive in. And it does, you have to be a little careful, but I think within reason, I think it's very I think, you don't have to be too serious about it. I think it should be fun. I will say that you should just be careful, though. I've seen people post on Facebook scenarios like HIPAA violation kind of things about patients, or, I operated on somebody today and it was so amazing. And I'm like, well, that patient could be, this is like public, so they could figure out that you operated a hysterectomy today and you did it. Just be careful about posting those kind of things. I see trainees doing that. if it's a more closed platform like Facebook, where you're talking about your Facebook friends, you can probably be a little bit more open. But even then, I think people take screenshots, and a lot of people have been reported about social media too. So I think just be careful.
We are a group of educators here at APGO. We had several questions about use of social media in the education setting. So from undergraduates, such as, clerkship, medical school clerkships, residencies, fellowships, any advice on either including social media in education or creating a social media platform for your, say, residency program?
I definitely think that in this day and age, residency programs should be creating social media platforms, in terms of Twitter and Instagram websites in particular. I don't know about TikTok, but I have the impression that Instagram is very important in marketing your program. Now, I mean, Cleveland Clinic has great, I think interviews great in terms of in person, but since we're not having people come, it's hard to impart the flavor of your program. I think the connection online is super interesting. I think one of the controversies I saw play out just a couple of weeks ago was the orthopedic surgery Google Doc, where people were commenting on other residents, female candidates and women of color, and things like that. I think that was like a pitfall in terms of promotion. I think it's extremely important. I actually also noticed a trend of prospective candidates, like medical students, putting headshots of themselves and introducing themselves on Twitter. And then some advice about like residency program directors giving advice to their residents to put themselves out on Twitter. I'm not quite sure that fellowship directors really care about that at this point, or residency program directors. But I do think advertising residency program initiatives on being family friendly, parental leave policies, dedication to DEI initiatives, the things that initiatives that and days that people are doing for wellness. It just paints your program in a very positive light. And and I think that it's hard to convey that on like a website. So it's an adjunct to what you're doing. And honestly, a lot of places that I've at in DC and here, the residents actually run the social media. So I know it seems overwhelming, but they're really good at it. They're natives in social media. So I was at the workshop, and they're talking about meetings and running a meeting and delegating, and leadership is delegation. So you should delegate the social media presence to your residents to try and convey some of that stuff. And they're very savvy about this, and they know how to put the best foot forward, I think.
Well, that was, so the people that ran that breakout was Dr. Claire and Dr. Morgan, and they both agreed with you in the chat that with some guidelines, residents and students, are excellent at this. They live in this, and they can help build and grow that. Yeah. Dr. Park, I do look forward to meeting you in person one of these days. I will continue to follow you on Twitter. Thanks for the shout outs personally. Thanks for the connections that you've helped me make through social media. And thanks for this great talk. It was awesome.
Well, thank you very much. I think there were some, were there some questions on?
There are a few more, and we're going to answer them. I think we'll take those offline because it's 2:45 and we're at time.
Okay.
So I'll bring those over to you, and we can follow up with the other people who had questions. And I just want to say thank you to everybody for joining us today for this first day of FDS. It was really a success. We will be back tomorrow at 1 p.m. EST, Eastern Standard Time, for day 2. So join us for that. Please check out the agenda in Whova. Sign up, keep on communicating and networking. Keep up that competition. We'll see who's on the leaderboard. I know it's not me, but I will get back at it. And thanks everybody for your participation today. Be well, take care, and we'll see you back tomorrow.
Great. Thank you.